of this, let's bring in Dr. Elaina George, an ear, throat, and nose specialist who's against this bill, and Jim McLaughlin, president and partner of McLaughlin and Associates. And Dr. George, we'll start with you because I'm told that you dislike both Obamacare and also this particular bill. So what are you looking for?
I'm looking for something that's patient and doctor-centered. Neither one of these bills, the law nor the House or the Senate bill, does anything to fix the rising costs of health care. That's the major question that's never been answered. Having health insurance does not equal access to quality health care. And I can tell you I see patients every day who have insurance but can't afford to use it because their out-of-pocket costs are way too high.
Jim, I see you nodding.
Yeah, no, she's right. Dr. George is exactly right. That's the big problem with Obamacare right now. It's too expensive. Premiums have more than doubled. It was supposed to be the Affordable Care Act, and even everybody from Bill Clinton said it was a disaster, and Bernie Sanders also is saying it's wrong, and he wants to go to government-run health care, which I think is the worst of all worlds. The quality will be terrible, and also it's going to increase costs, and taxpayers won't be able to afford it.
Dr. George, as a doctor, I don't know if you've perused the new bill. What about it concerns you most?
The fact that it supports something that's unsustainable. They give bailouts to the insurance company, they give money to the states, but there's nothing in there that talks about price transparency. There's nothing that's patient consumer driven. And ultimately, we're in a position where patients don't know the cost of health care. And if they don't know, they can't make a conscious decision. And as a physician, we're really on the front line where we're losing patients. Doctors are closing their offices. I'm a private practice doctor, and I'm only one of the 30% left. Before Obamacare, we were 65% of the doctors practicing. So this is having a devastating effect on independent practices.
Well, just to clarify, and since Jim mentioned it, is your position that you would support something like single payer? Because then, for example, Medicaid for all, everybody would be covered and people can make whatever decisions they want, and then you would get reimbursed by the government?
Absolutely not. And as a matter of fact, I think that this House bill is a faster movement towards single payer. It puts the whole structure in place for the government to take taxpayer money and subsidize insurance companies without anybody looking at what insurance companies are doing. They deny care, they say it's experimental, and in Georgia, they're actually in the business of beginning to practice medicine, where they're going to deny, Anthem is going to deny payment to emergency rooms based on what they deem to be an emergency, not what the doctor says it is.
Now, Jim, as we know, there have been problems with health insurance companies with Obamacare. Many of them have dropped out of states. Premiums have been rising. So Obamacare is not the solution, according to Republicans. Is this bill the solution, in your opinion?
And I think it's more than a solution. I think one of the things it's going to do is get to the crux of the real problem here. One of the things it's going to do, it's going to create more competition among the insurance companies. One of the big misnomers in this is they're saying all these people are going to lose. They're going to lose their health insurance. It's basically what they're talking about is Medicaid. That's one of the big problems with Obamacare. We have 72 million people now on Medicaid, which is the type of insurance people don't necessarily like, gives you the worst care. Patients will tell you it's a tough outcome, and it's really, really hurting doctors. What we want to do is create more competition for the insurance companies, and the other thing we got to do is let people sell insurance over state lines.
But if the issue on the Republican side is Obamacare premiums are going up too fast, the CBO report came out and said that within 2 years, this bill would cause premiums to go up 20% higher than Obamacare.
You can't trust the CBO on this stuff. Let's be honest.
Why not?
Because the CBO, they're the same people that told us that premiums were going to go down under Obamacare. We all know they more than doubled under Obamacare. They're also the same ones that told us about 20 million people were going to go into the exchanges, and less than half of them actually went into the exchanges.
And the reason only half went into the exchanges is because the CBO was counting on states not to exempt people from the Medicaid exemption. So the number would have been right based on the calculation if states hadn't done that.
What we need to do is make it more patient patient-friendly, more consumer-friendly. We need to give patients more choices. If the more choices we can give to patients, the better off they're going to be. And it's going to make it more friendly to the hospitals. It's going to make it more friendly to the doctors. We want to be able to let people choose what kind of insurance they need, and that's what's going to make it more affordable. The problem is all these mandates that Obamacare put on these insurance companies, that's what's driving premiums, that's what's driving costs through the roof.
Well, Dr. George, if there is no mandate as there is now, what would incentivize people to buy health insurance? I mean, surely that's a problem that they need to be pushed to do it. Otherwise, they would have done it on their own accord.
You know, I take the opposite opinion. Why not have a better product that's affordable, that covers what you want it to cover, and then you wouldn't have to force people to buy something that they can't afford and don't want. I'd like to see the community rating be removed. That's the tenet that everybody pays the same amount, whether they have a health problem or not. And keeping your children on until they're age 26, those are two of the major players that have caused costs to rise, because you're removing healthy young people who would otherwise have to buy the product. And put the catastrophic plans back in play. They were stripped out by Obamacare. So again, the free market needs to run and let people pick what they want. I agree with your other guest that it's about choice, but I would expand that to say it should be outside of insurance as well. There's direct primary care practices, there's cash-only practices, there's sharing ministries, there's a ton of things outside of the insurance market that people can choose.
Jim, your thoughts in terms of the politics of this and whether McConnell can get this through?
Oh, I think he can get this passed, and I think we need to get it passed. Forget the politics of this right now. People's lives, people, you know, think of how many people lost the good health insurance that they liked under Obamacare, and even worse, think about how many people lost their doctors under Obamacare.
All right, Jim McLaughlin and Dr. Elaina George, thank you both for joining us. Appreciate it. Good to have you.
Thank you.